I'm Kelsey Martin. I'm the Dean of the David Geffen School of Medicine. And again, I want to welcome everybody who's joined this town hall. And I want to thank all of the panelists who are on with us. We're here to talk about the research ramp up. I want to put that in some context. And the context is that we, as you all know, we had a very rapid ramp down of all research activities on the campus and in the school in March. And that was really done in response, a responsible response to the COVID-19 pandemic. We've worked over the last month, several weeks, with the Office of the Vice-Chancellor for Research, Roger Wakamoto, and other colleagues from across the campus, and guided by our infection control and prevention colleagues and experts to determine how we can begin to slowly ramp up our research activities so that we continue to realize that essential part of our mission, all of the research that is so important to solving critical health problems, to solving biological questions that we want to make sure that continues so that we do make progress, but that we do so in a manner that is safe and responsible. And that has led to a design of a research ramp-up plan that was sent out from the Office of the Vice-Chancellor for Research, and that I'm going to turn it over to Steve Smale to describe in more detail. But before I do so, I want to take also this moment to acknowledge what an incredibly difficult time we are all experiencing for really now months. We've talked a lot about the stresses that the pandemic has imposed on our community, the stresses in terms of the uncertainty, the changes in the way that we lead our everyday lives. That has been just profoundly disruptive to all that we do at the David Geffen School of Medicine. The anti-Black violence that has occurred over the last week has exposed a level of injustice in our society that really gets at the root of what we do and what our mission is, and has led to a sense of incredible not just unrest, but frustration, anger, unhappiness, and I have to acknowledge that. I have to let you know that we are also here to stand in solidarity across our school, across our university, across our city, and to be very cognizant of what we can do in our actions to address that injustice. So with that, I would like to turn it over to learn more about some of the details about the research ramp-up from Dr. Smale. There will be time if people can begin to use the Q&A section to put questions. We will have time to address all of those questions. And with us today, we have Arash Naeem and Melissa Fitzmaurice-Nelligan to talk about clinical research ramp-up, Jeffrey Goodwin to talk about any questions around DLAM, Aaron Quinn to talk about questions around building safety, lab safety, and really very practical issues about the research ramp-up, and Annabelle de St. Maurice to address questions around COVID-19 and infection prevention, and then of course from the Dean's Office, Steve Smale and Emily Marcus. So Steve, if you can take over, thank you.
Yeah, thank you, Kelsey. The reason we scheduled this town hall for this time is to to highlight some of the key points that were in the ramp up guidelines that were released by Roger Wakamoto, Vice Chancellor for Research, last week, to really answer questions and to clarify points about how this will work at a practical level within the School of Medicine. So I'll address the first topic, that I think is really on everyone's mind, which is when is this going to to happen. And the reality is that we don't yet know. One of the main challenges right now has been refining the online system that's planning to be used for approval of each PI's laboratory research plans. I had an expectation until a very short time ago that the online system would be released today, which would then allow PIs to fill out submit their online operational plans, which we'll discuss in a minute, and then have them approved by a chair or division chief, and then through us in the dean's office, and then research could begin ramping up essentially at that time. When those approvals come in, which would likely take about a day. There's a recent rumor that it may not be released until next Monday, and I have messages out that that right now that I might even have more clarification on that. During this town hall. So we don't know the date, but it's going to be very soon. It's not. I think there were some that were a little bit confused by the last week's email and thought that although the guidelines were being released, that the ramp up would not begin until August. But that is not the case. I thought it would be this week. It may still be. If not, it would be really hard to imagine it going beyond the beginning of next week. So what the plan was that was developed through a ramp-up committee that was chaired by the Vice-Chancellor for Research is a plan that interestingly, I think the vast majority of universities around the country have been converging on. They've all developed independent plans, but as we see more and more plans from different locations, they essentially have the same components. And the components really are, most importantly, to begin with focusing on a low space laboratory density. And the way that's been defined, it's guidelines. It's not precise. You don't need to go in and be exactly measuring each square foot of your space. But the general spirit of the guidelines is within a laboratory research is one person per laboratory bay. That even if you can fit 2 people in there with 6-foot distancing, that is not acceptable because of the fact that people are moving around, and we want to be extra cautious at the beginning with the idea that we want to see how things work before moving to higher densities. So the idea is one person in a typical conventional laboratory per bay. For non-conventional rooms, approximately one person per 250 square feet. And we consider that to be 10 to 25% density. This intrinsically is not overly fair because this means that laboratories that are have a larger number of people to begin with will only be able to have a smaller percentage of their total staff in their space at any given time, whereas very small labs may be able to have everybody there. But there's no way to really solve that problem at this point. We're hoping the low, ultra low density phase will only last for a couple of months, and then we'll be able to move to a higher density. So that is the plan for the basic rule of thumb for laboratories to maintain a low density, and then the expectation, and hopefully people are doing this now, is that PIs will be communicating and lab staff will be communicating with people in nearby spaces with whom they share equipment rooms and other things, and coming up with scheduling strategies and other plans for being sure that they can maintain low densities and limit interactions within those spaces as well. For the more common building areas, such as elevators and entrances and corridors and restrooms, that the campus is is working on plans and signage for those spaces, again with the goal of social distancing and limiting interactions. And we'll be posting those within the next couple of weeks, but the ramp up may occur before that is all posted, and individual labs and departments can develop temporary plans and put up temporary signage to try to limit interactions before that official signage goes up. In addition to the distancing issues and the low density, there's a campus requirement that we want to fully endorse and enforce within the School of Medicine in all buildings at all times, except if someone is completely isolated for a long period of time, that everyone will be wearing face coverings. And the only time you would not be wearing a face covering would be if you need your own face covering, would be if you need specialized PPE for a particular procedure. And of course, it's important to think about other safety issues. Of course, if you're using open flames, to make sure you have a non-flammable coverings, and be cautious about other safety issues. In addition to the distancing and the masking that everyone is expected to be filling out the daily symptom survey that's been released by the campus, that this has been released not to everyone. It's been actually formally announced to hopefully all employees, and will be announced to students shortly. But before anyone comes into a lab, that they should be registering for the daily symptom survey. That if you're a student, that you can still register through the symptom survey that's been set up for employees, and then there will be a process of transferring that registration over to the student site when it becomes available. At least that's my understanding. And then beyond those issues is that frequent disinfectant of equipment, that lots of sanitizing wipes and 70% alcohol to spray down equipment and spaces that people are touching and potentially contaminating. There's also the campus is developing in collaboration with the state and the entire UC system, a contact tracing strategy that will be apparently implemented a little bit later in the summer, but is not yet available at this time. And there's discussions about, especially before the undergraduates may come back, about widespread testing, but that currently is still in early stages of development for UCLA and at a campus-wide level. But the most important thing is just to really work within the spirit of those guidelines, and to understand that this is a really important issue. Is that if there's a cluster of infections that appears in a laboratory building, that's going to likely shut down the entire building for a prolonged period of time. In addition to the more obvious and serious concern is that you want to keep everybody safe. And I can say that this extends well beyond the research community, that we've had construction crews that have been in already working throughout the shutdown for some of the renovations, and just for the simple purpose of their recognition that it's in their best interest for their staff to stay safe. They've gone to great extremes to create a safe environment by bringing in their own sinks to put it at entrances to rooms, so that their employees could wash their hands frequently every time they enter and leave a room. So we really expect and need the research community to be just as aware that this is a very serious concern, an issue, and that compliance with the policies, that this is not just bureaucracy, that compliance with the policies is a very, very important and real thing. We're going to be closely monitoring, EHS is going to be closely monitoring, and we really need to address issues of non-compliance when they occur. And so in terms of the nuts and bolts that of the process is that as soon as the Vice Chancellor has this ready, that there will be an email that will be sent out that will have a link to a DocuSign site that every PI needs to go to fill out a form, listing their, it's actually relatively short, that it just requires a summary of your plans for infection control within your personal and shared research spaces, how you're going to coordinate that. It needs a list of of all of your personnel with their contact information, so that's available. And some of this information will then be collected and analyzed to be able to look at overall densities within different buildings and to create a database of who was actually permitted within the research laboratories. The template for that is already in the guidelines document. Hopefully people saw that and can start working on collecting the information they need in advance, but it must be submitted through the online system. And once it's submitted, it will go to a chair or division chief that, if for your department that hopefully I've been communicating with chairs and CAOs, hopefully everyone has had some sort of communication from your department indicating who you should be listing as the person in the department who will sign off on it. Is it a chair? Is it a vice chair for research? But it's important to make sure that you're listing the department chair or somebody that's going to be designated to approve those plans. The chairs are expected to look at that, with knowledge of their space and make sure the plan seems reasonable, that it takes into appropriate consideration the common spaces. Once they approve it, it will come to me for approval. And when I approve, I have to input a date when the lab is capable of beginning their ramp up, and the date will generally be the day after I review it. So this will all happen very, very, very quickly. So that's the process. I think there's a lot more, and I'm sure there's a ton of questions, but I want to turn it over quickly to Jeff Goodwin at this point for a few comments about the plan for the vivarium animal spaces.
Yeah, thanks, Steve. So we sent some guidance to our researchers that use animals last night. So I'm trying to pull that up real quick. I can just go over just very quickly some of the main points from that. So I understand that we don't know the exact date of when this phase 2 of research ramp up begins, but we're here and we're going to resume actually accepting animal orders, requests for imports, exports, breeding requests, that kind of thing. We understand that people need to kind of get going on these things so that they can be ready to start their experiments when research begins. So we'll actually, we're resuming those things right now. As far as working in the facilities, we've, again, in this guidance that I've sent to everyone, we've tried to kind of interpret the VCR's guidance and what this means for the animal facilities in regard to PPE, for instance. We understand most people are going to be wearing those cloth masks or their personal masks when they come to the facility. EH&S would like us to not have people wear those in the facility, so we're supplying surgical-like masks for people to wear once they're in the facility, and those should be available at the facility entrances. We also have disposable gowns for people to wear too. The physical distancing, we will try to help maintain that by limiting the amount of people that are in most of our animal rooms. So that means probably 1 to 2 people at most in most of our animal holding and procedure rooms. It's probably limited by the number of change stations or like biosafety cabinets that people will be working at. So we're trying to we've got a lot of rooms, about 300 or 400 of them. So we're trying to get those signs up in most of those rooms so people understand what the limits are there. But for the most part, it's going to be 1 to 2 people per room. There's also going to be calendars on the rooms so that people can sign up if they have some work that's kind of time sensitive and they want to secure that time in their room. There's a calendar for that. It's not required, but it should be there for their use. Again, not required, but hopefully that will be helpful for people. As far as facility access goes, I think we understand that with people there's going to be pressure for people to want to work past kind of the normal times if they're trying to schedule different shifts of people in their labs. There might be people that want to work late. Unfortunately for the animal facility, we have kind of the lights go off in the animal rooms at 6 p.m. For a reason. I think most people understand that, we're trying to maintain, kind of control all variables and in the animal facility, and certainly disturbances during the dark cycle can have effects on research. So we're trying to kind of stick to that, to the 6 a.m., 6 p.m., lights on, lights off time. And I guess our message to people is that, we understand there may be some pressure to go past this. And if that's needed, just reach out to us and we can try to work out some kind of solution for that. The other thing is researcher training. I think with people coming back, there may be new people. I assume there's going to be a lot less people, probably a lot less undergraduates on campus for a while, but there may be some training needs. And our training team is here. We're really restricted by PPE now in this case. Some of our training is kind of shoulder to shoulder, so we need some specialized PPE, which is in very limited supply. So people should just keep that in mind as they're making their research plans, that they should reach out to us if they're going to need to have trained people. I think that's it. Those are the main questions. I saw one question earlier about large animal surgery. We understand that that's one of those special cases that generally you do need 2 people in the room at any one time. We understand that. We know that in those rooms there's going to be a lot of PPE being used, and so any kind of questions like that, you can reach out to us and we can help you kind of address that in your operational plans. And that kind of goes for anything. We have probably almost 400 researchers that use animals. Like I mentioned earlier, we have 300 or 400 rooms, lots of different scenarios, lots of different things going on, and it's hard to really anticipate all the special things that could make it hard to do the research with these restrictions. So just reach out to us if there's anything that's not going to fit, and we'll see how we can accommodate that.
Okay, thank you, Jeff. I think we want to next turn it to Erin Quinn, who, for those, I think most of you know her, but Erin is I think her official title is our Director of School of Medicine Safety, but Erin actually has a much larger role that she oversees all of our, we're all getting a curfew alert, I think, right as we speak. But Erin oversees our emergency planning and continuity planning operations, all of our building managers in the School of Medicine, the loading docks, so Erin would be one person to include on the list of people that you need to include for for who oversees your common spaces, because she's generally directly involved. So Erin, do you want to add a few comments about?
Certainly. Thank you for the introduction, Steve. So the very first thing, this is a question I'm getting just via email and phone, but I'm also seeing in the Q&A, who's my safety coordinator? I would invite you to use my name if you're uncertain, but there is a department safety coordinator in each School of Medicine department, a building coordinator for each School of Medicine campus building, and there's a lab safety coordinator in each lab. Dr. Smale actually sent a message to folks about a week ago, giving you some suggestions of including my name, your department CAO, and your safety coordinator or building coordinator in the list of 3 names. If you include those 3, my understanding is that those names will receive copies of your submission to DocuSign once you're able to submit your operational plan template. But if you have any questions at all, I hope you'll feel free to reach out to me. 2 other things I'd really like to mention to you. First of all, a number of questions are coming in about central sourcing of disposable PPE. EH&S has created an emergency PPE supply store. It'll be recharged to folks who need it at cost. And there's a full website that I will post in the chat as soon as I can. And if departments want to coordinate centrally at their level, you can reach out to Eliza Leva from Campus EH&S. You may know her as a Controlled Substances Program Administrator, but she's also available to help work with your department at that level to make sure you have what you need for your researchers. Although it's not recommended by the CDC that every single person wear and use disposable PPE if they're essential staff, we should all be wearing fabric face coverings unless we're in total isolation, as has been reiterated, and that does apply to researchers. And then the very final thing I'd like to mention is a little more detail on the physical distancing protocol that's been created by campus leadership. It's actually developed in partnership between UCLA and UCLA Health, which I love to see. There's going to be a media package deployed to School of Medicine buildings and all campus buildings that will include uniform signs with instructions on physical distancing, wearing face coverings, washing hands, and some more targeted instructions in certain areas. You'll see these show up in the next week or so at building entrances, stairwells, restrooms, elevators. There will be elevator lobby floor stickers and other places. If you have any questions on any of this, please let me know, but we'll see more communication about this in the coming days.
Thank you, Erin. So the one main topic I didn't cover yet is for clinical trials and human subjects research. And this is really important for those who are involved in those activities, because according to the guidelines that have been circulated by the Vice-Chancellor, that it implies or states that, and if you look at the operational plan form, implies that PIs would need to fill out a plan for each of the projects, trials that they would be involved in, with a lot of detail about where the trials are taking place, even though many of these trials are being done in already established clinical spaces with very strict SOPs. So what we've decided to do is that we're working with the department chairs and CAOs, and hopefully they've communicated this to you already, because I've communicated with them and asked them to communicate with their faculty, is that we're working with the chairs and CAOs to have bulk or batch approvals of ongoing trials, where they would have a committee or themselves look through the trials that have been continuing through the ramp down phase 1, and approve those that really make sense to continue. For new trials that were shut down, it would be useful to justify, why under this time it's reasonable to ramp up. That as many of you know, that the trials that were allowed to continue during the ramp down phase were those that were having a potential for a direct benefit to the patient, those that were being performed in clinical spaces, and those that were where they were piggybacking onto a standard of care visits in a clinic, and those that could be done entirely remotely. So now for the phase 2, studies are permitted to continue that that are potentially of no benefit to the patient or participant, but where the risk of can be minimized to a sufficient extent. And those, I think, the departments want to look at particularly carefully. So those would be still good to send a separate justification through an operational plan for approval, but everything that's been continuing, which will be the vast majority of 5,000 approved trials, we'll do in bulk. One question that's been coming in that's quite common is, that involves the ramp-up documents, is that, can PIs who have already filled out the documents on the PDF guidelines just get that approved? And the answer is no. Unfortunately, it's necessary to go through the online system, and that's for just the logistics of the process. If we start allowing everyone to use all different types of processes, that's going to destroy my life, for one, because that means that I've got to be available to accept plans in all different formats, and we're expecting hundreds and hundreds of these. So please, to get approval, you must go through that process. The other reason that's necessary is for the data analysis to be able to to figure out the true occupancy and the personnel and get them into to databases. I also wanted to now just turn to your infectious disease expert, Annabelle de St. Maurice, because there's a question about what is the evidence that the local epidemic has slowed enough to do the ramp up with increases in cases and deaths. So Annabelle, can you comment on that?
Sure. I think one of the challenging things as we look at data related to COVID is that the number of tests being performed has not stayed constant. So we've seen a dramatic increase in the capacity of Los Angeles County to be able to do tests. So one of the things that we look at is the percent positive in addition to the number of cases. And it does seem like overall the percent positivity in Los Angeles County is around 8%, which is much lower than it was early on in the pandemic, suggesting that although we are seeing increases in the total number of people who test positive, that is likely due to an increase in test capacity within the county. We are also looking at our own internal data, and fortunately at UCLA we have seen a decrease in the number of hospitalized people due to COVID, so that is all very reassuring, and our percent positivity and total number of positive cases at UCLA has really decreased significantly. So these are all good signs. We do follow LA County recommendations, and LA County, based off of the increased testing capacity and ability to do increased contact tracing within the county, they feel that it is safe to continue with our reopening plans.
Great, thank you very, very much. So I apologize for jumping around, but just as we were getting our infectious diseases expert input, one thing that was kind of where I had also reached out to Annabelle and also to EH&S that was regarding additional safety measures that laboratories should be taking, because there's been suggestions that should everybody in laboratories be wearing gloves, disposable gloves and disposable lab coats at all times. And the recommendations that are coming from both infectious diseases and EH&S, and there's been documentation that EH&S sent that disposable gloves is not recommended for routine laboratory work, not only because the gloves are in short supply, but even more so is that it's thought that the number of times you would need to change your gloves every day for that to be effective just is completely impractical and unnecessary. That it's recommended that just frequent hand washing and disinfection of equipment is preferred. Also, no real benefits of disposable lab coats in most settings. Another question that came up is your question about cold rooms. Is there special precautions there? And the general consensus, again, from both groups of infectious diseases and EH&S is that there's been very little extra concern that's been discussed, other than cold rooms are of a size that should really only have one person in the cold room at a time. And with masking, sorry about that, something coming up. So there should be no extra precautions that are needed. So others on the panel can jump in with questions that they've seen on the Q&A. And I have Rosh, I don't know if you and Melissa, if you wanted to say more about the clinical side that I didn't cover. Or
seems like there were some questions that came in about a lot of the research that will probably ramp up may have some intervention happening to the subject, like a blood draw or something else like that. And I think the guidelines are set up to allow for those sorts of activities to happen during the ramp up, provided that the risk to the subjects is kept to a minimum. And, trying to reference the same sort of steps that we take when a subject comes in to the health system to try to ensure that they're at minimal risk. And a lot of that is in the document that I think campus provided. I think, for research for which there's no immediate benefit to the subject, we just want to minimize the risk. And so if we can have the research proceed in a way that really does minimize that, and we share that information with the subjects so that they're knowledgeable about it, I think we're trying to figure out how to incorporate that in the ramp up. Melissa, maybe you want to add more to that.
No, I was going to say, I just actually answered a few of those questions. Yes, you can do it. I think one of the big differences between phase 1 and phase 2 and the risk mitigation protocols is really in phase 1, the therapeutic studies. We've been able to leverage, most of these are done in clinical facilities. So we've been able to leverage the UCLA Health clinical protocols for screening patients and disinfection and so forth. As we move into phase 2, a lot of these studies are going to be more likely to be done in non-clinical settings. And therefore, it's going to be more onerous on the PIs and the study teams to ensure that you're doing the appropriate disinfecting between study patients and ensuring that all those risk mitigation strategies they're located on page 16 and 17. There's 6 bullets in the thing, that those are all being applied regardless of whether the site is clinical or non-clinical.
Thank you.
I want to just make a suggestion. There are many questions about, whether you can have the PDFs approved. And I do want to just make the suggestion that if your chairs do approve the PDFs, that will make it much faster for them to approve the DocuSign. They will obviously know that they've already approved the plans and be able to approve it very quickly.
Yeah, of course, that means I would need to look at it twice, so some may be open to that or
Well, it looks like some have already done that.
Yeah. I do have a late-breaking news here, because just before the meeting was when I wrote to Vice-Chancellor Wakamoto, and he replied and said that they are actually shooting for releasing the document late today. So it actually could come out today. It's likely to, unless there's a last-minute problem they encounter, he said. And he said that he did indicate that there may be an indication that a proposed date would be June 8th, which is next Monday, but that is a soft date. He says if the buildings are ready to receive researchers, they can start earlier. And so I think our buildings have, the reason that's there is that some buildings at other parts of campus, the air has been shut off. And so there's, because they haven't been occupied. And so facilities needs to do some work to get them ready to occupy. Our buildings have been occupied for essential research all along. So I think we're really ready to receive researchers at any time. So if the online document is released today, please put your plans into the online document, submit to your chair or division chief, and hopefully they do need a little time to evaluate the plans, but they hopefully it won't take, my hope is within 24 hours, but it will depend on individual departments.
I also want to bring up, there are a lot of questions about parking. I've answered one of those, but there are additional, and I want to let people know that did come up today on the provost meeting with all of the deans, and that's a question that has been escalated, because we understand that in particular as we're bringing trainees back in low density, and we don't want to have, individuals taking public transportation, that this is a concern. So we're waiting for an answer on that. There are also some questions about building security that maybe, Erin, you can take. Will all the doors be locked? Are there any changes?
Certainly. Thanks, Kelsey. I was finishing answering a question. So we're going to continue to have all the School of Medicine buildings on controlled access, which basically means that if you don't have 24/7 access on your Bruin card or your UCLA Health ID badge, you won't be able to get in. But it's easy to correct. If you need access, you can email my team. I will put the email address in the Q&A in a moment. Security is still present in the CHS complex and on that city block and is still available as a resource for us 24/7, 365. The rest of campus, of course, is served by UCPD and the community service officers, which offer a number of security-related services. I'll share some follow-up information on that as well.
There was a question about, surveillance testing of faculty and students, and many of you may have heard that that UCSD in particular has started a surveillance testing pilot program, and I don't want to take that much time in today's town hall because it's a very complicated topic. But there are strengths and weaknesses to surveillance testing plans that are also dependent on what is feasible and practical to do. There's been, the UCSD plan is interesting. It's got problems. It may be useful. It may not be useful. It's something that remains to be seen. It's for UCLA and other UC campuses. It's under discussion both within the individual campuses and through UC-wide committees. At UCLA, there's currently no formal plan to do that. Through the considerations of the strengths and weaknesses of such an approach. Certainly, if the limitations, if you could do it in a ideal scenario with unlimited swabs that are healthcare worker collected, it would be great, but that there's limitations at every level. Those are a couple of them. Okay, let's see, what else is coming up here? I can go.
How about eating in common areas with the research ramp up?
So this was actually addressed this morning on a campus-wide building coordinators meeting call. That question came up. The guidance from the group putting together the physical distancing protocol doesn't have specific guidance on this point yet, but I will share that it is within the scope of departments to make choices about what they prefer their folks to do in their own departmentally managed common areas like break rooms or lounges. I personally probably wouldn't choose to eat my lunch in a common lunchroom.
Mm-hmm. And it's all related also to the issue of trying to keep the buildings and the campus at the goal is a low personnel density and as low as possible. And for that means that if people are coming in on shifts, you don't want somebody sitting there spending a lot of time eating lunch while somebody else could be sitting at home because they can't get in to do their experiments. So there shouldn't be many people that are just hanging out and having leisurely lunches, a fast break, and a lot of this in terms of the compliance that this is phase 2, that we would like to be, of course, moving toward phase 3, which is a doubling of the density as soon as possible. That's going to be dictated by the degree of compliance with phase 2. And also by the sense of nobody really knows what this is going to look like, from the Chancellor's office to EH&S to us. That if as you walk around the buildings and look through the labs, is 25% density and how people are going to handle that? Is the campus going to look crowded? Is it going to look like we have a problem with with people maintaining appropriate distancing, or are we going to see people that are not complying with masking policies? That that all of those things could dramatically delay the move to phase 3 and phase 4, and could even cause a reversal back to phase 1 if it looks too troubling. So so compliance, making sure you're compliant, making sure your neighboring labs are compliant with all of the guidelines, masking and distancing and densities is really, really critical. And I actually think the vast majority of faculty did great with the ramp down compliance. So we're optimistic that this will work well. But
I want to also raise a couple of questions, or a theme that has emerged through the questions around training. And there have been questions about how to train individuals to use equipment, questions about new graduate students. I'm going to make a couple comments and then turn it over, Steve, if you have additional. One is that we are working with GPB, the graduate program in biosciences, to think about how we're going to manage that issue around, for example, rotations for graduate students, because of course there's a need for in-person training of new graduate students, and that's something with a lot of ideas that have emerged from using iPads for kind of remote learning. But I think, in this phase of this low density, I am anticipating that there will not be a lot of training of how to use new equipment. And if there is, it will have to be done in a manner that incorporates physical distancing. Steve, I don't know if you want to add to that.
Yeah, no, it's a tough one. I think it's something that, that individual labs will need to assess what will work for their particular situation. How much, can they accomplish in terms of training, under the circumstances. And I also wanted to point out that it is possible to bring undergraduates, existing undergraduates and medical students doing summer STTP program back into the laboratory if you put them into your operational plan. That the undergrads that people are most concerned about are those who are, trying to do honors thesis projects or are involved in formal, programs that, that are laboratory research based. We don't expect a lot of people bringing new students into the lab at this point because they need to, maintain their own staff and get them into the lab. But again, you need to make your own personal decisions on what is compatible with your particular situation, and it can't come with which you can't ignore. Say I'm training somebody, so I'm going to ignore all of the the guidelines and policies.
Questions about shared space. Would we include things like ice machines and other types of equipment where there's very short interactions? And I can tell you from my experience, we are including those in our plans. So, but Steve or Aaron?
There's not enough. The documents are pretty short. So, in terms of what you can include in your online document, that I'm not sure many people will be able to get down to that level of detail about ice machines. But come up with a plan that makes sense. There's one item, for example, in a small room adjacent to my my lab that the door has a window on it. It's very easy to see whether other people are in their neighboring labs use that. And I don't even think but they use it only for a few minutes. I don't think there's any need to have a schedule for that. People can look in the window. If nobody else is in there, they can go in and use it. If there's somebody in there, they wait. It's not, because it would only be 5 minutes. Wait till till it's available. So just do what makes sense for your space. Obviously, if it's a piece of equipment that's going to be used for an hour, it would be important to have a scheduling process in place to limit density. But you don't. There's again, you don't need to spell out every detail in the operational plan because there isn't space to do so.
Maybe, Annabelle, you can take, there have been a couple questions both in the Q&A but also emailed to me. I'm trying to monitor all my communications streams about, contact tracing, and if an individual is identified who's positive on a floor or in a research lab, what are the policies here?
So we will work closely with Los Angeles County Department of Public Health on contact tracing. We're still in the process of developing a plan kind of on campus because As you know, anytime contact tracing is performed, it requires quite a lot of effort to trace down any positive contacts and close contacts, but only those who were in close contact with someone would be notified. But currently at this time, given our limitations and our universal symptom monitoring and universal face masking, we are limiting contact tracing at this time, but we have ongoing discussions with the LA County about how they can support us in this effort. But more to come. But even when we are able to restart contact tracing, we would still only notify people who had come in close contact with a confirmed individual, which is currently defined as being within 6 feet of someone for 15 minutes or more. So only those people who would need to know would be notified. But as I said, this is kind of an ongoing discussion, just given where we are in the pandemic.
And Annabelle, while I have you unmuted, there are also questions about masks and about, what are the advantages of a surgical mask over a cloth mask? When should N95s be used, et cetera? If you could just address that. I see a number of questions around this.
Yes, and this is a question I've been receiving a lot of emails about, text messages, you name it. It is definitely a very hot topic. We know that the main mode of transmission of this virus is through droplets. So droplets are large particles that travel short distances and don't remain suspended in air. So that's close contact with someone. There's also the potential that if you touch your mouth or your nose, your eyes, that you could contaminate a space or surfaces or items that then somebody else touches and then touches their mucous membranes and then transmit the virus. For droplet transmission, the main and best way to prevent transmission is through good hand hygiene, physical distancing, and then we also think that surgical masks or cloth masks might be effective as well at preventing droplets. There are some situations in which aerosols can be created, and that's mostly in the medical setting when there are aerosol generating procedures that are performed, and these include things like intubation or bronchoscopy, and those might generate aerosols in which you would want to wear a mask like an N95 that can protect against aerosols. So for typical day-to-day situations, we recommend surgical masks or cotton masks, cloth masks, when not interacting with COVID-positive patients. When interacting with people who do have COVID, the recommendations are, as long as you're not performing an aerosol-generating procedure, that an N95 is not necessary. And one thing that has come up is a Lancet article that was recently published. It was a meta-analysis, and there were a lot of flaws with that study. I'm happy to talk about it at some other point if any of you have questions. I know Dr. Schmale had emailed me about it. But this study looked at N95 versus no mask and concluded that N95 is superior. And there are a lot of challenges with those conclusions, and I think the media kind of blew it up, but we still remain very confident that surgical masks provide adequate protection, and that in a non-healthcare setting, cloth masks can add some layer of protection as well.
Steve, there are questions about the core ramp up and the core facilities. Can you address those?
Yeah, I didn't get to those specific questions, but the core facilities are also expected to submit an operational plan through the same process for approval, but core facilities are able, in fact, some of them were given approval to open up early to get their system, to address their backlogs of samples that they may have collected before the ramp down. And as long as they submit an operational plan and maintain the same guidelines of distancing and masking, they're good to go. The clinical core facilities have to, of course, have more detailed SOPs to make sure that if they're going to be working with patients or study participants.
I think we're running up against the hour now, and I did want to make a comment that this town hall is being recorded and will be available. And as it is recorded, so are all of the questions that have been posed. And we will commit to using those for frequently asked questions. We obviously could not get to all of them. I do consider that it's important for us also to hear the questions that you have. And of course, everybody who's on this panel today is available to answer specific questions that may not have come up on this particular town hall. We are here to support all of you in every aspect of what you do. This really is a time, I think, where we have to come together with some kindness and understanding and recognition that we are not in control of what's happening in the pandemic, certainly, and that we're working to allow our individuals to complete their important missions in as responsible a manner as we can. Steve, if you have any other final comments to make, I again also want to thank all of you for participating.
Yeah, no, I think we're, I was just looking through more of the questions and we don't have time to answer them, but we will be putting out FAQs. I'll continue to communicate with chairs and CAOs who all really should have been communicating with faculty, research faculty over the past week with some of the other communications we've sent to them. Feel free to send me messages that haven't been answered. And again, as Kelsey, really, we hope to make this work. Compliance will be important. We'll continue to monitor and make adjustments as needed. And hopefully you'll see that message from Vice-Chancellor Wakamoto by the end of the day so we can get moving forward.
And to those, some messages that we didn't get to that I think are also important to acknowledge is that we are very aware that there are some individuals who are not comfortable coming back in a ramp up and do not want to feel that pressure. And we are working to develop mechanisms and strategies and guidelines that they are able to convey that, and we're able to respect those wishes on the part of those trainees, staff, and faculty. All right. I guess with that, I want to thank everybody again, and especially I want to thank Vice Dean Steve Smale of Research for just an incredible effort to make sure that we're all able to conduct our work. So thank you. And thank you all.